Here's a solution for the pain that you get in the back knee when you're doing split squats. Good morning, happy Friday. I have Neuro Coffee in hand and it is perfect. That is really good. All right, time's a wasting. We got to dig right into today's Q&A to wrap up the week. This comes from Tony, and Tony says, "Hi Bill." Hi Tony. He says, "I have a female client that complains of knee pressure and sometimes pain in the left knee. It only occurs when she's doing some form of half kneeling with the left knee down or when the left leg is the back leg on back lunges or split squats. She says that her quads feel tight in the same position. She can squat without feeling anything in the left knee. Can you help a brother out?" Tony, I am here to help the brother out. All right, thanks for all you do. All right, Tony, we've got a very specific situation. We've got a very specific position. And so this kind of narrows down what the possibilities are. The most common situation that we have here is we have somebody that is using a late propulsive strategy on the left side in a situation where we want to be in the middle. So we want an IR representation on the left side of the pelvis and in the left hip in the bottom of that split squat. And if we can't achieve that, then what we have is a situation where we're in an ER position and trying to produce force. And we know that ER is there for us to access motion. So we usually get a split squat that looks like that, something like that anyway, where you'll see sort of like the back leg sort of moving away from midline and you'll see it turning out. And that is, again, that's an externally rotated position. And so let's look at this through the pelvis real quick. So if we look at it from the back side, what we end up seeing in most cases is we get this posterior lower compressive strategy, which is going to move this left ilium forward. So we have a sacrum that is facing the right. When we drop the left leg back in the split squat, what we end up with is an orientation of the whole pelvis turning. So the relative position of the sacrum to the ilium is that the sacrum's still trying to go back to the right, and we've got this ilium that's actually pushing it there, and so we just get a turn like so, and then the back leg ends up in this position away from midline, which is actually still external rotation. And so what we want then is a solution that's going to recapture the ability of that sacrum to turn left, because if we don't do that, what we end up with is we have, again, the left side of the pelvis is forward, so the ilium is forward, rectus femoris picks up concentric orientation, that can increase pressure on the anterior knee, and then we got vastus lateralis, which tries to become this internal rotation muscle because we don't have any internal rotation orientation in the pelvis. So then what we have is just a massive amount of concentric orientation in the front of that thigh. So that's why she's feeling that tightness that she complains about. But we also get that compressive strategy on the anterior knee. So what we want to do is we want to try to capture a pelvis position that looks fairly level in the lower part of the split squat. So if we look at a comparison, you can see that when we have the orientation of the pelvis to the left, you can still see that external rotation. All right, so here's the solution. Number one, we want to eliminate interference. So when people complain about this quad tight feeling, there's this tendency to want to go chasing some form of stretching for the hip flexors or the anterior hip or the quad, and it ends up looking something like that. And that is actually just a reinforcement of this late propulsive strategy. And so again, we tend to not want to go there. We also get this situation where people will say, oh, you have weak glutes, which is, again, not really the situation that we're dealing with. And then we end up doing glute bridges and they end up looking like that. And so again, all we're doing with these activities is reinforcing this late propulsive strategy. So if she's in late, then what we want to do as our first layer of strategy is we want to move her all the way to early. So both of these situations are concentric orientation. One is a yielding strategy and one is the overcoming. So she's in the overcoming. We want to create the yielding strategy, which is actually going to start to turn our sacrum to the left. So we're going to initiate this in an early propulsive activity. And so we could just use simply in the gym, we go to a supine armbar and we're going to start to recapture that ability to turn the sacrum. This can then move into a left rolling pattern. So we're going to start with an early propulsive strategy in the roll, and then we want to move towards middle in this rolling activity. This can eventually become then the right arm bar that will approximate this same position. So again, we don't have to lay anybody on the table, we don't have to do any measurements, we don't have to treat this person like a rehab client. We have one scenario to deal with here, and that's all we're going to chase. Now, because of the orientation of the pelvis, she's going to have probably a situation where she's going to have an eccentrically oriented pelvic outlet, and we want to make sure that she can capture concentric orientation. Now, the cool thing you mentioned in your question is that she can squat without pain. Awesome. So we can already start to work on that. So what we want to do is we want to start to work on maybe a touch and go box squat, so we can capture the concentric orientation of that pelvic outlet and start to work on the shape change of the pelvis so we can capture this internal rotation. From there, we can use an overcoming squat in a static position that will also teach her the concentric overcoming strategy in the pelvic outlet. So that gets us our pressure management that we're going to need in the bottom of the split squat to hang on to this internally rotated position. Now we can start to move into split stance activities. So the first thing I like to do is just to do some sort of static representation of this. And what we want to do is we want to create a situation where we're actually pulling ourselves towards this overcoming action through the thorax. So we can actually use the thorax to help us start to build from the top down. So if we pull the thorax into the overcoming and we resist that, we're actually going to start to teach ourselves to keep the pelvis turned to the left in a stressful situation, so in a loaded situation. So again, that's why we're going to use this cable representation. Now, from here, we're going to move this into a dynamic situation where we're going to move back into the split squat, but we're going to use an offset load. So we load the right side, which is going to make it easier for us to maintain the external rotation on the right side, which is going to keep the pelvis turned to the left as we descend into the split squat. Another strategy that I really like that becomes a very strong challenge for this is to use the 3D strap from the What's That Strap guys, and it'll shove you hard into this late propulsive strategy. And so now we're creating a tremendous amount of resistance, and now we have a very strong effort to keep this pelvis turned to the left as we descend into the split squat. So again, we're just raising the level of challenge here to help us resist the overcoming strategy, so that late propulsive strategy on the left side. So as a wrap up, so there's a lot of possibilities here. There's a lot of ways to address this. This is just one of many. But the first thing I would say is you're in a late propulsive strategy on the left side. You want to go early to start to address this to achieve this pain-free situation. Next, make sure you can capture exhalation, internal rotation, and pressure management strategies internally, because you're going to need that concentric orientation of the pelvic diaphragm. You're going to need the internally rotated position of the pelvis at the bottom of the split squat to make sure that we have eliminated this concentric orientation on the anterior aspect of the hip and the thigh, and then challenge them to hold this position to resist this late propulsive strategy in the split squat. Tony, I hope that helps you. If you have any further questions, go to askbillhartman@gmail.com, askbillhartman@gmail.com, and I will see you guys next week.